Hello and welcome to NCTV episode 24, and this one is all about the immediate treatment of acute injuries. Firstly, why is immediate treatment so important? Well, that's because the success of injury healing can be boosted by appropriate, effective and timely action, particularly in the early stages of an injury, i.e. the first 72 hours. So a little bit more about acute injuries themselves. Any soft tissue is subject to injury, including ligaments which join bone to bone, tendons which join muscle to bone, and muscles themselves. The immediate reaction of the body is similar irrespective of what the soft tissue is, and it's known as the inflammatory reaction. Injuries can be caused by overstretching, bruising, or crushing, and a strain describes overstretching of a muscle, while a sprain describes overstretching of a ligament or tendon. Now onto the inflammatory reaction. Tissue injury usually involves damage to small blood vessels, and that results in bleeding at the site of injury. The bleeding leads to four main stages of inflammation, which are 1. Heat. Chemicals released from the damaged tissue causes dilations to surrounding blood vessels, which bring healing agents to the area, and the result is more blood and therefore heat. 2. Redness, and that's due to the increased blood to the area. 3. Pain, which is caused by chemicals released from the injured tissues, as well as the increased pressure from the fluid acting on nearby nerve endings. 4. Swelling, which is the result of this accumulation of extra fluid. This inflammatory reaction is necessary and part of a natural healing process. However, the body tends to overreact to sudden traumatic injury, and as a result, more inflammatory fluid accumulates than is necessary for healing itself. This fluid contains a protein that turns into replacement scar tissue. If too much is allowed to form, it may prevent the structure returning to its normal function, with reduced flexibility and increased risk of injury. Anyone experiencing an injury should benefit from following the following recommendations, which should be carried out immediately and for up to about 3 to 5 days after the injury, depending on the severity. These are remembered by the acronym PRICE. P is for protect, with regard to the injured tissue, that is, making sure that it doesn't undergo any undue stress that may disrupt the healing process and or cause further injury. This can be done by splinting or bandaging by a medical professional, or simply just with rest, slings or crutches. Just say though that complete immobilisation isn't usually necessary or desirable. Also make sure the method of protection can accommodate swelling. R is for rest. Rest reduces the energy requirements of the area, avoids any unnecessary increase in blood flow, ensures protection of the area to optimise healing. To do this, you could use slings, crutches, or static rest, i.e. sitting or resting down, or lying down, sorry. You don't need to completely rest all the time, but any movements need to be carefully considered. I is for ice. This is used to limit the body's overreaction by reducing the temperature of the injured tissue and therefore the energy requirements and subsequent influx of blood. The ice helps constrict the blood vessels, thereby limiting bleeding and reducing the accumulation of unnecessary tissue protein. You can use crushed ice wrapped in a tea towel or a plastic bag. Also, a frozen gel pack or a packet of peas from the freezer can be practical substitutes. Note that a damp towel must be placed between the ice and the skin to avoid ice burn. And the sooner the ice is applied, the better, and it should be applied for around about 10 minutes. Make sure not to return to the activity immediately, as the ice will have an analgesic numbing effect. C is for compression. This limits the unnecessary accumulation of inflammatory fluid and ultimately overproduction of scar tissue. Simple off-the-shelf compression bandages such as tube grips or an adjustable neoprene support, they're best for self-application. The area should be compressed for a minimum of probably 6 inches above and below the actual site of the injury, and it should be flexible enough to accommodate initial swelling and to continue to apply pressure as this reduces. Be sure to loosen the compression if you do feel any pins and needles around the compressed area. E is for elevation, to lower blood pressure and therefore help to limit the bleeding and encourage drainage of the fluid through the lymphatic system. For this you can use pillows, footstool or slings, etc. When following price, it's also important to avoid harm. Hence the saying, give price and avoid harm. Harm is another acronym where H stands for heat, e.g. a bath or sauna, A for alcohol, R for running, and M for massage. Again, these are things to be avoided immediately after injury. Hopefully you'll now be well equipped on what to do next time you suffer from an acute injury. That's your bite-sized bit to help your health flourish for this week, and I'll see you next time. Bye-bye.